CNBC TV 18 presents Be Fast, #No Stroke, Stay Safe.
Dr. Bindu, from a layman's perspective, how aware do you think people are about stroke and the essence of getting timely help?
If you look at stroke now, we already understand that stroke is an important cause of morbidity and mortality. But having said that, 80% of strokes are preventable. So if you look at stroke care, I would put it as in four perspectives. One is the stroke prevention. One should be aware about the risk factors of stroke so that they prevent, and 80% is preventable. Then comes the recognition of the symptoms of strokes, and that has been enumerated again. What are the symptoms of the stroke? Responding to the stroke is very important. As Dr. Padma said, that if a person has a stroke, if he doesn't respond and doesn't go to the hospital in time during the golden window period of stroke, that is well before the 4.5 hours window period of stroke, so that the patient gets a proper treatment in the proper patient in the proper hospital. And then the last one is post-stroke care as well. So even after the stroke treatment has been instituted, if the patient doesn't take medication. So the awareness has to be it goes across the spectrum from the prevention to the post-stroke care. So in all those four aspects. We are inching forward, and a lot of awareness activities are being done, and we can see in the hospitals, in the cities, in the tertiary care and the stroke-ready hospitals, the thrombolysis rate is going up. We are still inching forward, and a lot needs to be done, and I think we are hopeful that we will make it to that.
Dr. Bindu, could you share your experience about the role of stroke rehabilitations in recovery after stroke?
Rehabilitation process, which includes a good physiotherapist, which includes a speech therapist, it includes a language therapist. Then there can be vocational therapists will be there. There will be occupational therapists. There would be also a psychologist who will be involved in all this, because the patient can have depression, patient can have dementia. All these may not be available in many of the cities, but then if one looks at it, even if they go to their treating neurologist, if they mention each and everything, they would have a channelization of events, and they can be put together and they can be helped forward. This will help them. A proper rehabilitation process will help them to get back to an independent state as fast as possible. And that is absolutely very important. And that continuum of care should end till the